Hey everyone, it's Riley. So I have a update for you guys because on Wednesday, I will be exactly 6 months post-op already. It's crazy. I asked you guys if you have any questions, and you guys definitely gave me some questions. So I'll be answering them. And before I start, I just want to let you guys know, if you haven't watched my previous videos, that I had my top surgery with Dr. McLean in Mississauga, Ontario. So these questions, we'll be talking about my experience with him. Overall, how would you say the team was in terms of care and your experience with them? Overall, I think even from like beginning to end, my first day I went there, I don't think I had my name changed at the time. So, I put my name and then like my preferred name and then pronouns and stuff like that. They were very, very respectful, use the right name, use the right pronouns, made me feel really comfortable even right from the beginning. And then, the first day you go in, like to get your console, you have to take your shirt off. They'll like, look over your chest, kind of like see more or less what surgery is best for you, stuff like that. It's a little nerve wracking, especially, like being topless and stuff like that, and with people you don't really know. But, honestly, it made me feel 100% comfortable. It was weird, but it wasn't weird at the same time. It was like, really, really great experience for the first time going. And then, at the second time I went, they have so many patients I didn't, would never expect them to even remember. I walk in, they're like, hey, Riley, and I'm just like, whoa. So, to even, recognize me as a person, it was really, like, really great experience for that. Still kept calling me by the right name and pronouns, made me feel very welcome, just felt really good, just being there, really great atmosphere. And, the day, like, of the surgery, and the week before, made sure I knew everything that was going on, made me feel, 100% comfortable with my decisions and stuff like that, and made sure, I had everything I needed, just the day, like the week before, I think, and the day of, it's really, really great. It's a little nerve-wracking going in for any surgery, but, made sure that I was comfortable in every way possible. And then, throughout my recovery, every time I went to go see them, made sure I was doing okay, made sure everything was healing properly. They're just a great staff in general. If you're even thinking or possibly thinking of going to him, I would definitely look into it and consider it, and hopefully you guys have a great experience like I did. What was my recovery like? So for me, my recovery was really, really good. I know the first, maybe 4 or 5 days I actually stayed down in Brampton with a friend, and who I really appreciate, the help with that, and being able to let me stay there, which is, instead of traveling from Barrie to Mississauga, it is quite a bit of a drive. It was only about 20 minutes instead. So anyways, the day of my surgery, I wasn't even that sore. I pretty much remember everything after surgery, waking up, going to my friend's house, calling my mom, stuff like that. I wasn't really too sore. The only thing I really found was my throat. And that was really it. The next day, or the next morning, I did find my left side was really sore. But I went there and I had a bit of fluid buildup, and they released that, and it was so much better. But overall, my first week, I would say, would be the hardest in general, because, you have to take your time. You can't really move your arms too much. You have to kind of depend on other people. You're not really allowed to lift your arms. Probably, like, even, like, that would probably be the most for the first week. For the first, month, you really have to be careful of how much movement, what you're doing, because you don't want to, hurt your chest more, and then, it needs to heal, plus you don't want to try and stretch your scars too much. So, but yeah, anyways, my recovery in general was really, really good. I was off for 4 weeks and had people here to help me when I needed it. So, yeah, it's really good, though. How long did it take you to feel like your nipples weren't going to fall off if they rubbed against something? I'm going to just say, like, I know, for the first week, you have the sponges. This is how Dr. McLean does it. Like, they put sponges over your nipples, because once they sew them back on, they need to, be able to stay on your chest. So they more or less sew a sponge over your nipples to hold them there. So when you're pulling up your binder, you have to pull it out and then, up, and then put it in instead of pulling it straight up, because you don't want to, like, hit it. Really hurts too. But once they get the sponges off, you have to, then you can shower, because for your first week you can't get the sponges wet, and so you have to, like, kind of, like, bathe yourself with a cloth, and it gets kind of annoying, but yeah. But anyways, after your first week, then once you get the sponges off, you can shower. But you have to actually face away from the water for almost another like week or 2 weeks. But yeah, so you have to face away from the water, and then if you want to like kind of just dab around and put polyspiron on it. Pretty much, I think for the next 2 weeks I did. Once you get out, and then you have to keep the wrap on it for I think another 2 weeks after your first week. At least some people do only 2 weeks. Some people have to do 4 weeks, depending on how you're healing. I think I did 3 weeks, but for I think it was around my 3 week mark when I took the vest off and didn't have to wear it anymore was when I noted like I felt like okay, like I don't really have to worry too much. I still kind of babied it a little bit closer to my 4 weeks just to kind of make sure, but I was just being extra cautious. But it was around my 3 week mark when I felt like okay, everything was healed and I could kind of like do or at least kind of somewhat like do normal stuff. Another question: how long did it take you to be able to work out? I think it was about between 6 to 8 weeks. I remember on my 4 week mark, I went back to see Dr. McLean. He said wait another 4 weeks. But sometimes it's 6 weeks depending on how you're healing. But even still, when it comes to working out, you have to be really careful when it comes to your chest. You don't want to overdo it. You don't want to overstretch it. It really needs to heal. It takes almost a year, I've heard, internally for everything to heal properly. Out externally, I'm almost at 6 months and my scars I've started fading finally. And I've been doing really well externally, but internally you don't really know how you're healing. So you just have to be really careful when it comes to working out within I would say the first year at least. Not saying you can't work out. It's just you have to be careful. So, but yeah, it was about 8 weeks before I could get the go ahead to actually finally start working out. How much sensation do you have you regained in your chest? Pretty much, I would say close to 90% overall. I've regained in my chest. Some of it is still feels like it's just not as much as it was before, but I think that's probably it's still healing, so I don't really know. I'm still giving it time to fully heal, but yeah, about 90%. And how long did it take for the feeling to come back? And are there different sensations in different spots of your chest? So it took about, I would say, maybe close to a month and a half for the sensation to come back. Between the first probably 2 to 4 weeks, or 8 weeks, or 6 weeks even. It was like the first 2 weeks I couldn't even feel it. It was like it's like when your leg is asleep, you can't really feel it. Like it's it's there, but it just has that really weird feeling. Well, when it starts waking up, it's kind of the same sensation that you get in your leg when it starts waking up. Like it's like kind of tingly, and you can feel the muscles kind of contracting, trying to like wake itself up. Well, it's kind of the same feeling for almost 2 weeks, maybe even close to 4 weeks, and so close to my 6 to 8 week mark. I could definitely start getting the sensation. Like I can now, feel up close to my collarbone. I can definitely feel underneath on my ribs. But when it gets closer to where my scarring, I can feel it, but it's a little bit different sensation. Same with around the nipples, or like in my chest. Like I can feel it, but it's just a little bit different than it was before. But even still, like I can still feel it. It's there. I know I can feel it. It's just a bit of a different sensation. So like I said, it's about 90%. And yeah, it took maybe month and a half, close to 2 months to regain my sensation. That's really all of the questions. Anything else? If you guys have any more questions, you can comment. I think for any other updates regarding my top surgery, it's just I've been trying to do what I can to let it heal. Still, I've been putting scar cream on it. Trying not to still overly do too much to stretch my scars. They have stretched a little bit. Over time, just I don't really, I guess, think about it sometimes, and I'm just doing stuff, and I'm like, well, shit. Just get so used to being able to do things like how I used to, not really thinking beforehand. So, that's really it, I think, for top surgery. Like I said, if you guys have any questions. But yeah, I love you guys, and I'll post again soon.